For today's session, we are going to talk about transcutaneous monitoring. So if the transcutaneous monitor is well maintained and calibrated, the benefits will be
accurate information will be provided regarding the patient's oxygen status. It will also provide a continuous information about the body's ability to deliver oxygen to the tissue and to remove carbon dioxide.
Hindi porket ikaw ang kasiping, ibig sabihin buong buo niya nang binibigay lahat sa'yo. Parang transcutaneous monitor lang yan. Nakadikit na sa'yo pero tissue tension lang pala ang babasahin. Principles of operation: transcutaneous measurement of PO2 and PCO2 require a heating element built into the sensor that elevates the temperature in the underlying tissue. Also, measured values obtained will differ from arterial values, having PO2 slightly lower and PCO2 slightly higher in arteries. This is an example of transcutaneous oxygen monitoring electrode, which is placed on a child's arm. For the application of transcutaneous monitor, we need to select sites which are highly vascular area, such as earlobe, upper chest, abdomen, thighs, or lower back if supine position. Do not apply the transcutaneous monitor on bony areas and those with limited perfusion. For the selection of sensors, temperature must range from 41 to 44 degrees Celsius, and the frequency of site change every 4 to 12 hours. This depends on the device and the sensor temperature. Heating of the sensor requires that the change site must be performed on a routine basis to prevent thermal injury, and also follow membrane changing procedure and calibration. For the procedure, prepare the machine and the selected site must be clean. Apply 1 or 2 drops of contact gel, NSS, or sterile water. Contact gel. So this liquid to liquid medium makes the diffusion of gases more efficient and accurate. The sensor is then attached to the skin with fixation ring or earlobe clip. The ring must be a good seal between the sensor and the skin. This is to eliminate air bubbles. Transcutaneous monitoring provides a non-invasive, simple means of continuously monitoring ventilations, but it also has limitations. Number 1, labor intensive. Considering the preparation, the frequent site change, and the membrane changes and calibration. Of course, it also needs extra time. A period of time exists immediately after the application, during which no values can be measured. The third limitation is not ideal for emergency. The usefulness of transcutaneous monitor for long-term monitoring is generally not concerned. However, for emergency situations requiring immediate action, a transcutaneous monitor may not be ideal. A transcutaneous monitor is limited in its usefulness during cardiopulmonary resuscitation and airway obstruction or apnea detection. Shock and certain medications can also divert blood from capillaries to central circulation. In all cases of reduced capillary perfusion, the capillary blood, which is measured using a transcutaneous monitor, may reflect measurements associated with central venous blood with a considerably low PO2 and higher PCO2. If a patient has poor integrity, transcutaneous monitoring may also be contraindicated.
Thank you for listening.